Another lady who came to see me for a tooth on the upper left with some chewing sensitivity. And when I took a look at the x-ray, it looks like that tooth number 13 is the one has problem with a periapical radiolucency. And usually these upper bicuspids have two roots, and this tooth looks like it only had one of the roots treated and the other one was never treated. So I told the patient what we can do is do a retreatment. We need to take the post out and look for the lingual canal. The lingual canal, it's right here. And there's a slight chance that the crown might fracture off and then she might need a new crown. Luckily, when we started doing the tooth, we didn't damage the crown and the crown stayed intact. So we went ahead and took the post out and found the lingual canal and went ahead and treated both roots, and this is how it looks like. So that tooth has two roots, and she was happy with that treatment. It looks wonderful. This is another patient that came to see me back in 2004. So this is a long-term patient that I've worked on many teeth with him, possibly 3 or 4 different teeth. This is a tooth number 14, has a radiolucency, so I told him to go ahead and do a retreatment on this tooth. So we went ahead and did the retreat on number 14, and this is a follow-up that I did with him. This is a 5-year recall when he came back to see me just recently. Then he came back for another tooth on the lower left. This is number 20. So went ahead and did number 20 for him. This is the tooth that we did for him on the lower left. And then he came back only a few months later to do the lower right side, tooth number 29. It has a crown with a large periapical or a large cavity on the distal. So went ahead and did the working length x-ray, and everything looks good. We did the final fill and it looks good there. Only thing that happened was he came back, I think I did this on a Thursday, he came back on Monday and said that he's still feeling a little bit numb on his lip on the right side. So from lower lip all the way to the corner of his mouth, from the midline to corner of his mouth was tingling and numb. And so the one thing that I asked him was if we're going to follow it up for next couple of days and see how it looks, to see if it's getting smaller and if it's tingling at this point. And he said, yeah, it is tingling. So when he said that, I felt much relieved to know that the nerve is not fully damaged and it will come back. It might just take some time. Looking at the x-ray, it looks like I'm right at the apex on this tooth, and it's not an overfill, but most likely the end result was that the port of exit at the apex was a little bit higher than the anatomical picture that we see here. So we went ahead and took another picture. That's how it looks, and then, most likely the mental foramen was right here, and the nerve was a bit damaged from the sealer that I used. Came back for the following 2 months, and I followed him up, and then on the 3rd month the lip was back in original feeling, and he healed well. And so that was one of the obstacles that I had to go through with him, especially being a long-term patient and a wonderful patient. Following 24 hours after the root canal treatment, following paresthesia is the ultimate time to go ahead with any kind of a sort of treatment, surgical treatment to correct this paresthesia. But if it's 3 to 4 days later, there's hardly any options left but to wait and see. And this is the follow-up picture with him.